Welcome everyone. Great to have you all here. Super excited for today's live session. Hi, I'm Yukraj Kishore and I'm a breath coach on a mission to help people to optimize their life but just by changing the way they breathe. And if you're joining live, please drop a heart in the chat box so that I can know that you are here. And let's start the real talk, everyone. Yeah. So today's topic is very interesting: breathwork versus therapy. What is more effective? Today, we are going to deep dive into this topic. If you are all set and excited to learn, be here with me, and I will take all the questions also towards the end. Yeah. So, just want to ask you, everyone, one question: that have you ever been into the therapy for months and maybe even years and still felt like something is still stuck inside you? Like, no matter what, you might have talked about it endlessly. You might have gone to the lot of therapists. um, you have done various kind of behavioral therapies. Still, the anxiety keeps coming up. Tightness in your chest, the way you freeze, in the social setting around people. It's like as if you have no control, and it wouldn't go away also. So that's what I'm gonna talk about today, and we are gonna go more deeper dive into this. Hello to everyone: Kartan, Rajiv ji, Viren. Great to have you all in the live session, and everyone those who are joining, or even some of you those who are listening later. So the most important question, if you see in the healing word right now that I am coming across is, and maybe you are also been thinking. Okay. Okay, I'm back, everyone. Thank you so much for still being here. I hope you all can see me and hear me well now. And am I audible loud and clear? Can anyone just confirm me? Anshul, can you hear me now? Yep. Okay. Thank you, everyone. Let's continue. Okay, so yeah, this session is going to be very, very interesting and it will give you a lot of insight. I prepared it and I really am excited. Thank you, everyone, for staying here, though we had some technical glitch. So, I want you to imagine that our body is like, suppose our body is like a house. Okay, our body is like a house. और एक तूफान आता है, there is a storm comes, and what happens, like the windows get shattered, the doors get jammed. It was a very, very terrifying experience for you, and yeah, you are shocked, you are traumatized with this whole experience. What happened to my house? Now therapy, like talk therapy, is like you're sitting inside the house and you are talking about the storm. Okay, that, oh, the storm has come, the doors got jammed, the doors blocked हो गए हैं, खुल नहीं रहे हैं, शीशे टूट गए हैं, and you are just talking endlessly. How does it make you feel? Okay, when people come and you talk to them, yeah, you feel good. But end of the day, when you look around into the house, it is still the same position, right? So that's what is happening when you are only depending upon therapies. Okay, talking therapies, if I have to share. Now, I tell you what happens when you know, start with the breath work. Okay, so can talking fix the house? Of course not. So breathwork is like you are going one room to another room, physically working on each door, working on each windows and fixing them, those jammed windows and doors. Okay, opening the stuck windows that are not moving, and gradually what you see is the doors that were jammed, the windows that were stuck. Since you have worked on each door and each window, they are now in a regular position, and now you can open the windows and let the fresh air coming in. Now when you look around your house, you feel good about it because you were able to fix them. So that's the difference between the therapies and the breath work. So therapies mostly work on the mindset, whereas breath works through the body. And something that I will tell you that will be, very, very profound for you is, most of the people think, when I ask them, where does your stress lies, and they always tell that it lies in my mind. I'm overthinking, I am negatively thinking all the time, and the memory keeps repeating to me. Now let me tell you something even more powerful. Trauma just doesn't live in your memory. Science has proved it that it lives in your muscles, in your gut, in your breath. Okay? Maybe you are unconscious and you have not yet been able to identify that where does the trauma is living in your body. But when you undergo breath work, the your body starts howling sometimes they start moving vigorously in whichever way, because you are completely shutting down your prefrontal cortex. That is your logical mind, that is your thinking mind, and you are going into your raw nature completely. Okay, so when you do breath work, what you are doing is you are truly healing. Sometimes you have to go below your mind. There are the layers. Okay. So now I'll share some science, because I don't want you to just take my words. There's a lot of science, and in fact, I would encourage you, please go and check out the work of all these great researchers I'm going to talk about. Do check out this book, The Body Keeps the Score. Okay, it is written by Dr. Bessel van der Kolk, and it's a New York-based best-selling New York Times bestsellers list for years. And he's a psychiatrist in Boston University who has spent his entire career spending on trauma. And you know what is his biggest discovery? He says that when something traumatic happens to us, the part of our brain is responsible for language, okay, that area literally shuts down. And he says that this is called a speechless horror. Now think about it. If trauma shut down the language center of your brain, how you're supposed to talk your way out of it? Yeah. And that's why the Dr. Vanderkolk moved away from just talk therapy, and he started integrating all these breath work, yoga practices, things that, the body's language, not just the mind. Okay. The book name is The Body Keeps the Score. You can go and check out that. Very wonderful book where you will get more insights. And in fact, in my breathwork classes also, I have shared many times, and I always keep sharing that how your body keeps storing the trauma in various parts of the body. And if you are having certain, you know, in your fascias, especially under your fascias, you are storing a lot of traumas, and that is also creating your gut health issues, your respiratory issues. And now I will share something very interesting. Dr. Peter Levin, okay, so he has about Dr. Peter Levin work. So he has actually worked very closely with animals in the wild for decades, in fact, and he noticed something very wild. So he found that when a gazelle escapes a lion, it literally shakes its whole body afterwards. It trembles, it releases the fear, and then again go back to grazing. Like nothing happened. So whatever the trauma he has got by, lion chasing him, he just shake it off and now very coolly go for the grazing. But what we humans do, we suppress that shake, we hold it on, we stay calm, and that suppressed energy stays stuck in the body. And he has, given this approach of somatic experiences, or somatic, you can say, experiences, like teaching the body to complete the unfinished survival response. Often it is done through your breath and the movement. And you can check out his book, Waking the Tiger. That I would highly recommend you. Waking the Tiger, sorry. Yeah, I hope you all are making note of the books, of course. Now, I'll talk about Dr. Stephen Porges. So he has coined something very interesting, and that has become later very fancy name and very popular. That is polyvagal theory. Feels fancy, but it is very simple. Okay, so according to this theory, your nervous system has a safety switch. When you feel safe, there is a nerve that is the longest nerve that is running in your body from your brain to your gut, and that connects your brain to your gut. And when you are feeling safe, you can laugh, love, learn, heal, everything. But when you feel threatened, it just shut off, and your body enters into the fight, flight, running away, escaping, or freeze. So you just freeze response. And I have come across many a times, and it's your just body's way of responding. And over the years, as I have worked with such people who have been into traumatic situation, and many a times it has happened that they have gone freeze. They were not able to speak for themselves for years together, and then they were blaming themselves, saying that, uh, I could have said, I could have stood up for myself. And that has been more traumatic to them than the incident itself. The incident that their memories is carrying, the incident that not just memory is carrying, it has been repeated so many times that the body feels anger, the body feels, reactiveness, the moment they think of it. Is it happening in the present moment? No. But just by connecting to the past memory, just thinking of that one person, that incident, that situation, they feel rage sometime. Okay, and they feel, upset, sad. How many of you have experienced that? A single memory. I personally have experienced it. I remember there was that there was one incident has happened, and I felt cheated in a friendship, and the mere thought of that particular incident used to make me cry, even though I was in my office space, and I was just crying. Was the incident happened in that moment? No, but still, my reaction was crying. Why? Because that memory has got triggered. Yeah. So when you connect with your breath, longer exhalation, it's a way to send signal. Your brain understand that signal, that yeah, my body is feeling now calm, and this is a direct way you can talk to your vagus nerve. So this is your polyvagus theory. Okay, so slow exhalation, narrowed slow exhalation tells your nervous system that yeah, I am safe, I can come back now, and there's no woo woo, just simply a neuroscience. So every time you feel trapped, breath is a, interrupt, pattern interrupt, you can say. You just go to your breath, start breathing, longer exhalation, narrowed pursed lipped exhalation. You can do uh, you know ha breaths also. Now, I'll tell you some real life example, the Stanford study, the real number. So in 2014, the researchers at Stanford University, Dr. Emma, she ran a study on US military veterans with PTSD from the Iraq and Afghanistan wars. So, in war front, there's a lot of all these PTSD things happen to people. Post traumatic stress disorder happen to people, and it impacts them a lot. So what happened is one group did breathing based meditation, breath work, and another group they were not given anything. They were not given. So there were two people, breath based meditation practices, and another was done given nothing. The result, the breathing group showed significantly reduction in PTSD symptoms, anxieties, and physical stress markers, and those results held up 1 year later at follow up also. Compared to the conventional treatments that were going on, studies showed that up to two-thirds of PTSD patients do not fully recover from traditional therapy alone. So I want you to just let it sink that 2 out of 3 people in therapy for PTSD still carry the diagnosis afterward using the traditional therapies. Now, let me make it even more real for you. For example, okay, you are driving and someone just cut off and you slam the brakes, and your heart is pounding, your hand is shaking, and even if the car is gone, you're still in a little shock mode. Your body is still feeling the danger mode, right? Your heart is still racing, your breath is still shallow, and can you just think your way out? Oh, I'm fine, it's okay, the car is gone. But just by thinking, is your heart stop pounding immediately? No. What does work? What how you can calm yourself down? A slow, long exhale. The moment you start exhaling in a longer exhalation, your vagus nerve activates the parasympathetic nervous system, and that itself will bring your heart beats down. Your body will start feeling rest and digest mode and brings you back to calm. I would really like to experiment it. Okay. So in regular session, if in regular practice you are doing some kind of breathing practices, any damn thing I would say around it. But I would certainly like you to experiment when you are feeling stressed out. If someone is saying something to you and you are feeling triggered, I want you to quickly switch to your breath. Expand your belly. Inhale, exhale, breathe out through your mouth, and just try to see, can you just be present fully? And this will give you a space, a micro intelligence, a micro space to process your emotion and not feeling triggered. Instead of being reactive, being more responsive, and your mind is actually not getting trapped and triggered by what other people are saying. You are present with your body. Okay, my body is feeling, my heart is feeling raised up. Let me work on myself. That should be your ultimate aim or ultimate goal, right? So your body understand the breath signals before your brain even finish the thought. So train your mind with your breath. I always say that, train your mind with your breath. Use your body signals. That means you can always shake. This can actually very helpful for you. Okay. Now I would share something real example, and as I already also talked about it, freeze response. I would like to share about freeze response. By the way, just a quick check. Have you ever experienced that when someone is saying to you, maybe your boss or anyone you have come across, and you are just frozen? You just don't get anxious, but you go blank. You just dissociate. You get numb. Has it happened to you? You know, something, and that dissociation when it happens, the the cycle is not complete. I'll give you an example. So, Dr. Peter Levin, a patient has come to him who was in a car accident and couldn't move her arms for years afterwards. No physical injury, but you know what it is? It was just a nervous system stuck in freeze mode. So when she started finally doing somatic breath work and movement work, she felt as if her body was completing something and her arm began to move again. So it was like the body has been waiting to finish a response it never got to complete. So are you someone who is more in your mind to deal with your such patterns, issues in your day-to-day life to heal, or you are using breath work, yoga? I also teach nirvana flow practices, that is profound practices that helps people to somatically also release, and then conscious breathwork practices, conscious connected breathwork, arc breathwork practices. These are the very powerful practices that can help you um, to close this loop and be present with yourself, and you start getting more and more awareness also, right? So now coming to the now I have given you a lot of examples and research data also. Now coming back to something that you might all be hearing from me, and actually I want you to tell me. So, with all this information, knowledge I have shared with you, what do you think? Is breathwork better than therapy? Let me know in one word in chat box. What do you think? Honest answer. Let me know, what do you think? Is breathwork better than therapies? Can you all just message me if you feel that breathwork, then message me a BW breathwork. If you feel therapies, then message me here T for therapies. TH for therapies. Those who are present, watching live, or maybe if you are watching later also, I would certainly be interested in knowing more about it. And then I will also share that what is my POV, my point of view. Okay, so here I share. Meanwhile, you can also think and share. Honest answer, it's not either or, it's both and. And here, how I want to use you to think of it. When therapies are good to understand your story, getting insights and building self-awareness. Oh, this has happened to me. Okay, this is also good working through the relationships and patterns. You must have that awareness. Oh, this is my pattern. People doesn't listen to me. This is my pattern. Okay, you will see the same pattern coming up. Even maybe you are the one who is seeing that you are losing job after every 1 year or 6 months, or you are someone who is stuck in the same job also, though you want to get out of it. So there could be a lot of patterns. Okay, so cognitive processing, changing thoughts and beliefs. This is where your talk therapies are good. Now, where is breath work powerful? Now, this is the somatic work, that is releasing what's stuck in the body, calming your nervous system in real time, reaching trauma that actually words. The talk therapy cannot exist because trauma lives in. Where does trauma lives? Can you all just message me here? Trauma lives in your body also. So breathwork also helps you to complete the survival response that never finished. And even the most, famous today's trauma therapist, if you go and check out the work, Dr. Gamermate, Vander Kolk, Levinsa, all of them says the one thing, that the best healing combines both mind and body. So let me give you a, a more idea about it. Think of that therapy as the map and breathwork as a vehicle, and you need both. to get somewhere, right? So, who might benefit more from breathwork first? If you have been into therapy for a long time and you feel stuck, breathwork might be the missing piece for you, and you must not miss that. Most of the people, of course, we all work with the logical mind. You do affirmations, you try to keep yourself positive, but breathwork could be the missing piece you are missing in, if you still feel stuck after a long time undergoing a lot of therapies. Okay, your trauma needs connection and closure. Okay, so therapy first is often wise if your trauma lives strongly in your body. Panic attacks are there, you're feeling chronic tension, gut issues, you don't feel safe. Then body based breath work, body based somatic practices is often where the real breakthrough will start coming to you. You can see that, and please connect to some trained practitioners for serious trauma. This is an information, not a medical prescription also. So, are you all ready for a quick, before I wrap up, for a quick practice? Let's do for 60 seconds something that can help you to directly stimulate your vagus nerve. So, where you can do this when you are feeling anxious, triggered, or disconnected. Yeah. I want you all to sit upright. Make sure that your feet are firmly on the ground. Ground yourself. Stay here. Yeah. And I want you to practice it with me. Deep inhale, hold, exhale longer, in, 2, 3, 4, hold, 2, 3, 4, longer mouth exhale, 2, 3, 4, 5, 6, in, 2, 3, 4, hold, 2, 3, 4, exhale, 2, 3, 4, 5, 6, nose in, 2, 3, 4, hold, 2, 3, 4, exhale through your mouth, 2, 3, 4, 5, 6. Take a deep inhale and deep exhale. Deep inhale and exhale fully. Awesome. So, longer exhalation, always remember, is the key. It activates your body's nervous system, parasympathetic nervous system, rest and digest mode, where your body feels calm. And I would like you to tap into this wonderful, powerful thing that is a breathwork, somatic breathwork. Now, as I wrap up, I'll give you a quick recap. Are you all ready? So, what all things you have learned today? First, trauma lives in your body, not just in your mind, as told by Dr. Van der Kolk. Your body has unfinished survival responses waiting to complete, as per by Dr. Peter. Your breath is the remote control to your nervous system by Dr. Stephen. And Stanford research showed breathwork reduced PTSD symptoms that lasted a full year. And traditional therapy alone leaves up to 2 in 3 PTSD patients without full recovery. And the most powerful healing combines both, that is, your mind as well as your body. And the breath has always been there. Always remember, everyone, it is free, it's always with you. And now you know scientifically also that why it works. Yeah. So do you all promise me that if you're living, breathing, you're gonna explore this breath work and because truly to experience your fullness, truly to experience your true potential, truly to drop all the mask, all the conditioning that unconsciously, consciously happened to you as you were growing and you never knew that. And who else but you are the master of your life? So master your life with mastering your breath. And if this helped you, please like, subscribe uh, the channel, and share what has been your biggest learning from this particular session. I would really like to know that. Share it with someone who is looking to, who needs such knowledge. Please share that, because I'm on a mission to help people to breathe right consciously and use the power of breath to attain mental peace, calmness, and fulfilled, happy life. Yeah. So I go deep on nervous system healing, breath work, and emotional freedom every week. In fact, we are running a breath mastery workshop also. It's a 3-day workshop that I run usually once in a month only. It's a live, powerful 5 sessions. And today, in fact, I'll be doing the conscious breath work practice also. So if any one of you are still feeling connected, and if any one of you still wish to join, you can actually, if you are already in our WhatsApp group, you can always connect, and we can share with you the link so that you can join today's practice. We are going to start in 7:30, right? We will be starting 7:30 tonight. Yeah. So thank you everyone. Thank you so much. Stay blessed. Breathe wellness and abundance. And this is Yuktiraj Kishore signing off. We are doing another workshop also, breath alignment masterclass. Every week I am doing. You can gain, if you are someone who is not into my WhatsApp groups in any of that, then you can be the part of it. I'm just sharing the number. You can use this number, connect to us, and let us know what kind of a practices you would like to do, and we would certainly love to help you out. Thank you, everyone. Thank you so much. Stay blessed. Breathe wellness and abundance. And this is Yukti Raj Kishore signing off. Do let me know what else you would like to learn from me in the next class. Thank you. Stay blessed.